Boom, shakalaka boom. You've tuned in to the Free Range Human Show of Choice, your daily dose of reality radio. This is the Clay Edwards Show. I'm, of course, Clay Edwards. I'm live here in the ClayEdwardsShow.com. So we get a studio sponsor. That's what we'll call it. The ClayEdwardsShow.com studios here at WYAB. We're streaming worldwide at WYAB.com as well as the TuneIn app and Alexa. Just search WYAB. And we are, of course, streaming in video live in living color, 4K. I look every bit of 47 years old in 4K. But can we go back to low-def cameras around here? Anyway, I'm on my Save Jackson, Save JXN, Facebook, YouTube, and X account. And I'm streaming to my personal Facebook, too, from the looks of this chart here. I'm not doing Rumble. Rumble been doing your boy dirty. I spend all that time setting it up, and then it doesn't work half the time, so I am waving the white flag on streaming live to Rumble. I'll still upload videos there, but the streaming days with Rumble have come to a halt until they quit charging and not working. So with that said, I'm live here in the studio. We got Dr. Carrie Snyder with Home Hearing Healthcare back in the studio. She was here a month or so ago, and it ended up being not because Carrie's not an extremely interesting person, but you just don't think that talking about hearing loss and hearing aids for an hour is going to be engaging radio. And I'd be dang if it wasn't one of the most engaging interviews I've ever had. We had tons of questions from folks. If you're in the live chat and you have any questions you want to ask Dr. Carrie Snyder, feel free to. I'll pass them along. Good morning, Dr. Snyder.
Good morning, and thanks for having me back.
Pleasure for you to be back. I saw this on the schedule. I know we set it up last week and finally landed on a day that worked for us, and was really excited to have you in here.
Yeah, I'm so excited to be back. It was such a great experience last time, so I'm eager to help more people out today.
And it worked, right? Yes, right. People called and they set up appointments, and that's always great is when you sell advertising and the advertising works. So, immediately as well.
Right.
So we always appreciate that. So what brings us back today? What is on your mind today?
Yeah, so there was a number of topics that we discussed last time, and I would like to go a little bit deeper into some of those. But I think one thing that we kind of touched on, but we didn't go very deep into, was how people pay for hearing aids. Because as we know, a lot of insurances either cover or there's no coverage. And so that's been a topic that a lot of patients have come in and is not a fun topic. Money is never a fun topic when we're talking about healthcare and how to make healthcare better. So we do offer and take insurances. We take Medicare Advantage plans, but the one that I really want to talk about today is something that's through the state, and it's called vocational rehabilitation. And it's
vocational rehabilitation,
and it's short. Everybody shortens it down to Voc Rehab. So a lot of people have heard of it before, and then some have not. And for those who haven't, I want to take the time to talk a little bit about it.
That's fine.
So what it is it's a program for individuals that are still working in the workforce. They're still in the workforce, and it helps provide services to them to continue working. So this is not limited to just hearing aids. There's a vision portion. There is, if you need a cane or assistance to help walk or anything like that, there's a lot of great options outside of hearing aids. But one of their options is to help provide assistance to help you hear better so that you can complete your job and do your job the best of your ability. And as we know, when you're not hearing, you can't do your job at 100% because you may misunderstand what's being said.
No, look, and I brought this up previously, having hearing loss myself, and when I've done your ad reads, I'm sure people are tired of hearing me talk about it, but I was amazed at some of the technologies that have come across, and I've actually thought more and more about it. He's like, you know what? I'm not too old. Maybe I should attempt that. I was out to eat last night, or I was judging a music competition, and of course I can hear everything in front of me fine, but I was at the far left end of the table, and everybody to the right of me, because I had somebody I wanted to talk to at the table next to my left, so I tried to I had to negotiate where my good ear is going to be pointing.
Right.
And it's like, do I want to talk to this person, or do I want to talk to these four over here the most? And I have to lean constantly. So yeah, the finances would definitely be an issue with having to get a hearing aid. Somebody that's got the minimal insurance and whatnot. So this is something that definitely piques my interest, as I'm sure it does a lot of others.
Yes, it really does. And it's an easy process. You come in, we get your hearing tested, we will discuss treatment options for you, and then we fill out the paperwork. And there's different Voc Rehab offices all over the state of Mississippi. And so we will look where you live and then send that information over, and you'll get an appointment with them. And then it just kind of starts the process of getting all of that set up and working. And so it's a wonderful program. In fact, I am a product of Voc Rehab. So when I was diagnosed with hearing loss and before I went to college, I set up an appointment with Voc Rehab. And it is so wonderful. Not only did they help assist me with hearing aids, they actually help assist me with college and paid some of my tuition. They want to do whatever they can to make citizens able to work in society and make sure that they can do that with all the resources they have. And so it is truly a wonderful program, and I'm a product of it, and I'm a firm believer in supporting it and helping patients be able to utilize their services.
So you can help them. How do they start? They just come in and see you, and then you can guide them in the right direction, get them approved or whatever?
Yeah, it's either way. They can reach out to vocational rehab directly. Their main office is in Madison, a very beautiful office here in Madison. They have wonderful counselors, but they can contact Voc Rehab directly to see what they need to do, or they can go into a professional and bring it up. You do have to see a credentialed provider with Voc Rehab. Not everyone is credentialed with Voc Rehab. So whoever you are seeing, you want to make sure that they are credentialed to be able to utilize those services.
Kind of like the equivalent of make sure somebody accepts Medicare, Medicaid,
correct,
certain insurances, stuff of that nature.
Yes, absolutely. And then they can all start the process in office or starting it within Voc Rehab.
And let's see what would be my next question after that. You see people get turned down too often, or is it pretty much kind of across the board? Most people get approved?
Yeah, so their standards have changed, or their criteria has changed some. And I don't really know what at 100% their criteria is. That's really not privy information to us.
It's like
I wish it were.
It's like big tech telling you the algorithm.
Yeah. I wish we had more insight how what gets what and all of that. But I honestly, since they've recently changed their criteria for this, I haven't seen anyone get turned down. So originally at one point it was financial based. I think they've removed that criteria, and I don't think that's really there anymore. It could be, but I don't really know that answer.
So we got a couple comments here on our live chat. So something like I said, I told you there's something new that we've added. I got a picture of you up instead of a camera on you. I got your picture off the website there, try to make it look as professional as possible. Steve asked, my wife has been diagnosed with hearing loss. Do you take United Healthcare?
We do, actually. It is one of our insurances that we take, and we do a lot of United Healthcare. Yes.
That's who I use too, so I'm glad he asked that. Lane says, had temporal nerve damage. Lane's a law enforcement officer, had temporal nerve damage that causes horrible tinnitus and some hearing loss. Any way to help this?
Yeah, so that was one of our topics I wanted to cover too, because hearing loss and tinnitus are so related. But research tells us about 85% of the time, a hearing aid alone will help with that tinnitus. And outside of that, if you're in that,
that's the proper way to say it, tinnitus.
There is two ways to correctly pronounce it. I say tinnitus because the other way of saying it, tinnitus, is so close to tendinitis that people can get it confused. So,
especially in your field.
Yeah.
Okay.
So I always say tinnitus, but both ways are correct. But yeah, research tells us 85% of the time alone, a hearing aid will help. If not, then there's that 15% of the time that the hearing aid alone is not enough. Then we can look into a masker that can be built inside of the hearing aid. We can take a notch out of it. We'll listen to it's called pitch matching. So we'll listen to pitches and then kind of notch out the area where that tinnitus is occurring. So there's several options outside of the hearing aid, but it's all built into the hearing aid. So we would always start with the hearing aid first and then go from there.
And somebody's asking for your link. What's the best way to find you online?
Oh, yeah, absolutely. homehearinghealthcare.com.
Nice and simple.
Yeah, very, very simple. You can also find us on Facebook at Home Hearing Healthcare. And there is links and information there. There's actually on my website a video about vocational rehab and my experience with vocational rehab, about how it being a full circle. So if you're interested in that, you can learn more and watch that video of how that impacted my life there.
All right, I like it. We're going to take our first break. We've got Dr. Carrie Snyder here with Home Hearing Healthcare, discussing hearing loss and more. She's got a few topics she definitely wants to hit today as well. If you have any questions, let them come in. If you're not online, if you want to send a text to the Guns and Gear text line, that number is 769-241-1944. If you'd rather call the Mazda of Jackson phone line, 601-879-0002. All I ask is during our first hour here with Dr. Snyder is just keep it on topic, and we'll get to all of the political and chaotic stuff going on in the world in hour 2. So if you have any hearing loss questions, let's stay on topic first hour. We'd love to hear them from you guys. We'll be right back on WYAB with Dr. Carrie Snyder. Online. Welcome back in to the Clay Edwards Show here live on 103.9 FM WYAB. This segment is brought to you by our guest this morning, Dr. Carrie Snyder with Home Hearing Healthcare. We are streaming online at all of the Save JXN social media platforms. Well, not all of them, but the big ones, YouTube, Facebook, and X. So if you want to see what's going on there, if you want to engage into the conversation there, we've got a nice little live chat going. If you want to call in, you got any questions about hearing loss, the Mazda of Jackson phone line is 601-879-0002. The Guns and Gear text line, 769-241-1944. Again, we've got Dr. Carrie Snyder in here with Home Hearing Healthcare. It's a lot of H's.
Yeah, it is.
Yep. So, Dr. Carrie, one of the things we were going to talk about was the different types of hearing losses. This is something that I don't know if a lot of people understand, that hearing loss isn't just hearing loss. It's not a one-size-fits-all thing. Like I have nerve damage that's irreconcilable, unfortunately, and there are other ones that can be fixed and taken care of with therapy and whatnot. So where do you want to start at talking about the different hearing losses?
Yeah, so there's actually considered 3 types of hearing losses. There's the nerve damage, like you're talking about, which is called sensory neural hearing loss, kind of the fancy medical term. Then there is a conductive hearing loss, which it can oftentimes be corrected. That can be earwax, that can be fluid on the ears. You could have some little bones in your ear that are not working correctly that can surgically be fixed. And then there's a mixed hearing loss. And mixed hearing loss is a form of both of those. So you have nerve damage, and then there's also a conductive component. So a lot of times once we fix the conductive component, you'll still have the nerve hearing loss. It just will not be as great of a hearing loss. The number one type of hearing loss that we see is nerve damage, like you have sensory neural hearing loss. And the treatment option oftentimes for that is either a hearing aid, or if a hearing aid is not an option, we would look into something called a cochlear implant. And a cochlear implant is for individuals who have a significant amount of hearing loss, poor word understanding. So it's important to understand, I think this is super important, and it's really not talked about enough, is in hearing loss, you have almost like 2 buckets of hearing. I can hear sounds bucket of loudness, and then I can understand bucket. So we want those buckets to work together. So when we program your hearing aid, when we put a prescription fit hearing aid on your ears and we program that hearing aid and match targets, we want your understanding to go up. So we turn the volume up, you hear and understand better. And so, but not every time that happens. So in your case, you have a good ear and then you have a bad ear. And on your bad ear, no matter how loud we make that side, it probably sounds like a busted speaker, or it's very, very distorted on that side.
It's very, it sounds like sound coming through a wall.
Yeah.
It's dead.
It's not clear. So no matter how loud we make that side, there's no true good understanding. So it's not usable anymore. And so we actually look at that when we're testing hearing. We want to make sure that you not only can hear the sound, but you can understand the sound. And a lot of times, sometimes patients don't understand that. They'll get hearing aids, and no matter how much we explain those 2 buckets and how they work together, and maybe their bucket for understanding is not the best. Like, we can say, okay, you're going to hear 60%, you're going to understand 60% of what's said to you, but then there's still times that you're not going to understand, around 40% of the time, let's just say. And that's a poor understanding. And so while they're going to do significantly better with hearing aids, sometimes they're still going to miss things. And so it's very important to have a good understanding of that. But yes, sensory neural hearing loss, nerve hearing loss is the number one thing that we see, and it's what most people have. And there's a lot of comorbidities that can go along with untreated hearing loss. So people...
I want to hear this.
Yeah. So people like yourself who choose not to move forward with hearing aids, and they wait and they wait and wait and wait. And hearing loss, is important to understand, happens so slowly. So it's not like most people wake up and they're like, oh, I don't hear today and I should go get hearing aids. It happens so gradually that you don't even realize that you're not hearing the blinker anymore, or that you don't hear the microwave beep, or that you're not fully understanding your grandchild anymore. It's because they think that people are mumbling, or that they just don't talk clear anymore. And so over time, as that happens, they slowly stop attending things. They stop finding joy in the things of coffee groups or attending functions. And then they are sitting at home more and more. Depression, isolation, loneliness, all of those things set in because of untreated hearing loss.
You know, I was fortunate, I guess you could say, that I don't remember life with full hearing. I was very young. My mom tells the story is I got a very high fever when I was young, and it caused some nerve damage. And so I this is all I've ever known. But as I've gotten older, I've become more aware of the difficulties or the comorbidities from it. I don't let it stop me from doing stuff. But like just saying last night, for example, having to rearrange how I sit everywhere. Like, who do I want to prioritize? This person or who's going to be talking the most, and whatever. And it is uncomfortable, and then you constantly, and you feel like you're a drag on people having to repeat themselves or talk louder. And these are all factual things that as you get older, it starts to affect you even more.
Right. And you start realizing when you're in those type of situations, you may not notice it eventually, but you don't talk as much, or because you're using so much of your energy to figure out what the person is saying. And so I actually had a conversation with a patient yesterday who had a very mild hearing loss. And she came in and she said, I never realized how much energy I use to hear because of my hearing loss. I feel like I'm always straining to hear, and I'm just tired at the end of the day. And so that absolutely happens. It's called auditory fatigue. And so by the end of the day, she's just tired, and other patients experience as well.
And it makes for strange, sometimes uncomfortable social interactions on one-to-one basis with people who may not know you as well, and may think you're weird.
Or ignoring them.
I get that a lot. And I just tell people, like, man, sometimes you got to do this, just wave at me, because if you're expecting me to think I heard my name going through somewhere, I've learned to ignore that, because everything sounds like Clay.
Oh, yeah.
Hey, all that. I always think I hear Clay, and I'm like, they're just going to have to get my attention if they're talking to me. But you're so right. But I'm going to tell you, and one thing that you brought up the last time you were here was the type of hearing aid for somebody like me that you thought could work. And I've seriously... It's moved from the back burner to potentially the front burner, because I went on a road trip since the last time that we talked, and had that very situation. I drove the whole way to Florida and back, and I was constantly like, you got to talk louder. That whole conversation. So it's just to tell people that didn't tune in, there's a hearing aid if you have one bad ear, that you put basically a microphone into the bad ear, and you put a headphone in the other ear, and it transmits the sound from the bad ear to the good ear, or from the bad side to the good side. So you can actually, if you're riding in a car, and say you have if you're driving, your right ear doesn't work, somebody sitting to your right, there's a microphone there, and you can hear everything over into your left ear as if you switch sides. And these are all very small devices. They're not like big clunky, like these headphones I'm wearing right now in the studio. These are smaller than earbuds at the time. At times I assume.
Yeah. So that system is called a bicross, and so that's absolutely right. The way
bicross.
The way you described it is correct. You have a hearing aid on your better functioning ear, and then a transmitter on the other ear, and they look identical. So it's not like you're walking around with two different devices.
They just operate differently.
Yeah, yeah. And so one transmits the sound. So if somebody's talking on your bad side, instead of having to turn your head to your good ear so they can hear you, it transmits it over to the functioning ear so you can hear it clearly. So yes, it's a wonderful option for individuals just like yourself that have a good and then a bad ear that cannot be aided. So we're always going to look at your scores and try to aid both ears to see if you can benefit from both ears. But in those cases that you cannot benefit from a hearing aid in your poor ear, then we're going to put a transmitter on there for the bycross.
Are there things somebody like me could do to other than avoid loud noises? But I mean, I'm guessing there's millions of reasons, millions of things that cause hearing loss, right? Mm-hmm. Are there preventatives other than just obvious stuff that you can do to prevent hearing loss? Like say you're starting to lose it in one ear, kind of like your health. Mm-hmm. You can start eating healthier to get healthy. Are there stuff you can do, exercises for your ears? Is there preventive medicines you can get on to stop hearing loss?
Yeah, really, there's really nothing out there besides protecting your hearing in those loud situations. And, of course, if you have ear infections, you want to go get that cleared up. The longer you let those things hinder the poorer the outcome there. That can cause a little bit of hearing loss. But just treating your ears with safety is the number one thing that you can do. Hearing loss has a genetic link to it. So if you have it in your family, you're likely. I have a hearing loss as well, and wear hearing aids. I have a genetic link. My father has it. And so we can see it kind of in my side of the family, how that could happen. There's also as you age, just like aging, we see aging and hearing loss hand in hand. So a lot of times people will come in and say, I have no one in my family that has hearing loss. And it's just everything starts breaking down in our body. So there's no ear exercises or anything like that we can do to help that not happen, unfortunately.
Maybe ear exercises wasn't the best way to say it. Maybe a physical therapy type stuff for your ears, but I guess that'd be the same thing.
Yeah.
You got a patient that's chimed in this morning on our chat. Terry Johnston says,
yes.
Got my hearing aids from Home Hearing Health. Dr. Snyder's great. I'm going to be setting up another appointment soon to get some in-ear earbuds and retire his behind-the-ear earbuds.
Yes. So there are different styles. That's what he's talking about. So there are devices that go behind the ear. And those devices actually have a lot of fun functionality to them. You can connect them to your cell phone so they can stream your cell phone calls, your podcasts, anything that's streaming, you can be heard. So they function as little earbuds, AirPods in your ears.
And, the great thing, too, about that is everybody's running around. You're not like in a socially awkward or anything now, or you don't look different than everybody because you got a hearing aid in, because everybody's running around with their earbuds. Speaking of which, one of mine have quit working that I go to the gym with, and I've just been working out from home because I won't go buy new earbuds.
Right.
Because I don't like the music, but they don't play music loud enough at the gym. So anyway, I digress. But you don't have to feel like you're different anymore with the hearing aids.
Yeah, and you're bringing up a good point. I need to throw this out there. So a lot of people are wearing earbuds and AirPods and all of that, and they don't know how to clean them. We're also about to purchase a device. It's called a Redux, and a lot of times when you work out, the sweat get into those devices. Wax. And so we are actually going to start providing a service where we can actually suck the moisture out of those earbuds and be able to clean those. And so you can visit us not just for your hearing aid needs, but earbuds, all of that. So we'll have something called a Redux, and for people who are excessive sweaters or wear them at the gym, a lot of time that moisture can affect those. And so we can put it in our Redux, and it runs about 10 to 15 minutes, but it will literally remove the moisture, and we'll be able to see how much moisture was actually in that device and was removed. So that's a great option for people who think, oh, hearing aids have nothing to do with me. It is audio devices that we can help you with there too.
Do you have an idea of what that's going to run financial wise?
Yeah, to run it through our Redux is going to be about $20 to $25.
That's fair, especially if you got a good pair, $100 earbuds. You want to keep them working.
Yeah,
I'd rather do that than go buy another cheap $25 pair and just keep throwing them away.
Right.
Because I want good quality stuff. All right, we got to take another break. When we come back, I've got some more questions for Dr. Snyder that you guys have sent in. Again, if you got any questions, the Guns and Gear text line, if the internet's not your thing, is 769-241-1944. Of course, if you're watching on Facebook, YouTube, or Twitter, X, you can chime in the live chat there, and the phone line is wide open, 601-879-0002. 2. And we got a couple other things that we're going to talk about that Dr. Carrie has written down here on these notes as well. So this is the Clay Edwards Show. We're on 103.9 FM WYAB. We'll be back in 4 minutes with Dr. Carrie Snyder, Home Hearing Healthcare. And hour 2, it'll be just me up in here in the studio, so make sure the kids are out of the car. I'm kidding. We'll be right back. Welcome back into the Clay Edwards Show here on 103.9 FM WYAB. We're back online streaming at WYAB.com as well as the TuneIn app and Alexa. Just search WYAB. We're on the Save JXN Facebook page, YouTube, and Twitter/X handle. I know y'all probably getting tired of hearing that, but we've made a big investment in it. We want to make sure you guys know we're doing it. If you're one of those people streaming, please hit the share button. This first hour, the whole thing, is brought to you by Home Hearing Healthcare and Dr. Carrie Snyder, who just so happens to be sitting across the desk from me. And, man, look, I love these conversations because it's an opportunity to break up some of the monotony and just the beating our heads against the walls, talking about politics and culture war stuff all the time, which we're going to do in hour 2, but this is the pregame. So, anyway, Dr. Carrie, I'm really enjoying this conversation. We've gotten some text on the Guns and Gear text line from a few listeners here with a couple questions. So I figured we would start with those. And I want to circle back to technology. You mentioned AI stuff a little earlier, as well as some different hearing aid designs. We kind of started that conversation but jumped down a rabbit hole, but I want to make sure we get back to it. Unknown texter says how to contact Voc Rehab in Madison for hearing aids. I think we said that earlier, but I forgot.
Yeah, so you can either contact our office at 601-351-5433 is our contact to Home Hearing Healthcare, and we can look that number up for you because it is kind of based on what county you live in, so we can give you a specific number. You can also go on Google and just Google Vocational Rehab Mississippi, and that will take you to their website, and you can find that information there. And so there's 2 ways there, but you can start with our office, and we're happy to help you get the information you need.
Yeah, and if you can't remember the phone number, homehearinghealthcare.com or Google Home Hearing Healthcare Jackson, Mississippi, and it'll all pop up there. All right, another texter says, is there a treatment for tinnitus instead of a hearing aid?
Yes, no, there's not. There's actually truly no cure for tinnitus. There is just things that you can do. So never sit in silence. So tinnitus is often noticed the most when you're sitting in a silent situation. So a lot of times people will say, when I go to bed at night, I hear it the most because it's silent.
What is a sign of tinnitus?
Ringing, buzzing, humming. There's even musical tinnitus. Some patients will say that they hear the same song over and over and over again in their head. That's musical tinnitus. I know when I was young and I would get my hearing tested, again, when you get your hearing tested, you're in a booth and it's quiet. And so a lot
sound
yes,
booth,
yes. And so a lot of people will say, I hear the ringing, and we work through it. But yes, I can remember as a child when I was getting my hearing tested, it sounded like a carousel, like a little carousel when you get on as a child. I could just hear that music in the background constantly. But yeah, if you hear something, there's no sound there, and that means that it's a form of tinnitus there. But yes, so there's no cure. But we can do things like don't sit in silence. So have the TV on in the background, a sound machine on when you go to sleep. So you're trying to mask it out. And there are some apps that we can look into and help you with, explain them. You can download. So there's some great apps out there that we can look into for tinnitus support as well.
Interesting. I listen to I don't have tinnitus, thank the Lord, but I do listen to just a little podcast or something, just a little background noise when I'm going to sleep, mainly just so I get out of my own head and I can go to sleep. Try to focus on something, and it helps me get to sleep. I have a question. This is from me, the host. I think everybody's got kids in the car right now, trying to get them to school. I think this is a very relevant question. The dangers of these headphones and these earbuds and noise-canceling headphones. I just want to make sure I word this right. Obviously, we know if you listen to stuff too loud, it's going to be bad for you. We got young kids out there. Do you have a message for them wearing earbuds all the time, listening to music in their ears, any of that? Is there a time where they need to take the things off, make sure that it ain't up too loud. What are some of the real dangers of hearing, of earbuds and stuff?
Yeah, I think that that's actually a very good topic to talk about, because you don't know what you don't know. And I think that parents sometimes do not realize how loud they're listening to. The number one thing parents can do is put the headphones on themselves and listen to how loud that sound is. And there's actually settings in all tablets or settings on phones where you can go in and restrict how loud they can turn that tablet, that device up.
Really?
And so that's the number one thing that parents can do. I know, like, my child, she likes it loud. And so we're constantly saying, Tilly, that's too loud. You need to turn that down. So we take it and we listen to it. And then sometimes it sounds loud outside of the headphones, but it's really not that loud on. It's just the sound leaking. But yes, parents being proactive and turning down and setting the limits on how loud those tablets can be turned up.
And then in the parental settings, I guess.
Yep, it's in the settings.
I had no idea they had a volume setting of parental settings.
Yeah, a parental setting for it, that option. And then also, just educating. I know that my husband, he talks about, I tell him all the time when he's out hunting and all of that, is he needs to wear hearing protection, because parents need to set the example that when dads and grandpas and all of them are out hunting, they need to have the hearing protection in too, because if the children see it, then they're going to do it. And my husband says all the time, oh yeah, we didn't do that growing up. And it was a thing. You did not do it when you were growing up. And now I think people are more aware and more cautious that guns can cause hearing loss when they're out hunting, and shooting and clay shooting and having fun, that they need to set the example for their children and put hearing protection in so they see it and they know to do it. And then they need to make sure that their children are wearing it and aware that it is very important, because once you lose it, you cannot get it back. And I think that's the big thing to realize, that it does not come back.
No, look, I mean, my phone will give me a notification every now and then. You're hearing your earbuds are too loud. And pay attention.
Right. If you wear an Apple Watch, and there's a health feature in the iPhones that you can turn on. And if you're in a setting that's too loud, it'll notify you and say, you've reached 90 dB. If you stay in this situation for, 30 minutes, it could cause dangerous hearing loss. And so, yes, so being in a certain loudness for 30 minutes, even levels louder than 90, it's 90 dB, you should only be in there 15 minutes. So there's a whole criteria of how loud to be in certain loud situations for extended periods of time.
And earbuds at concerts, I mean, like hearing protection at concerts, is that something people should consider? I mean,
yes.
I was in that business for a long time, and you'd be amazed at how few people wear hearing protection at concerts.
Even students in band, orchestra type things. It's you're blasting music. Band director is a big one. If you can imagine being a band director, he's standing at the front and that blasting music is coming at him. A lot of band directors end up losing their fine tuning of pitches because they have all that noise. So drummers, any of those things like that in band, children that young, they can still hear the music through the headsets. And there's actually filtered earplugs, so we can change out the different filters. So it's not occluding you completely. It's still allowing sound in, but it's providing you a level of protection that's not harming your hearing. But concert goers, absolutely. Brandon Amphitheater, if you're going there are protections there that will still allow you to hear the music, the words, everything, but provide you a layer of hearing protection.
I can't recommend that enough. After 20 years in the entertainment business, doing concerts and clubs and just being a lifelong concert goer, which I plan on going to concerts till I'm dead.
Right.
It's my jam. It's my one constant in my life is going to concerts, and it's something I got to start taking more serious.
Well, and it's interesting because as much as you love music, if the more and more hearing loss you lose, the less appreciation for music you will have. Yep. And so it is important to protect that if you have a music appreciation, because then you're not going to hear you'll hear the music, but you won't understand the lyrics. And that's the most important part to people that are listening to music.
Certain range of noises you're not going to hear. You may not hear a certain part of a guitar solo because you can't hear that tone. So a lot there. I'm glad I asked that question. I needed to be reminded of that myself.
Yeah. And those are personalized. I want to throw that out there. We do take an impression of your ear for that. And so those devices are molded to your ear. They're made specifically for your ears. And so it's a very, very good fit. It's just not like a foam earplug or anything like that. These are personalized for you.
Y'all offer these?
Mm-hmm. Yeah, absolutely.
Okay. So y'all offer hearing protection as well?
Absolutely. Yes.
That is good to know.
Mm-hmm.
So do they need to set up an appointment for that? Or
because
everything at the shop is
so there's different options. So there's passive and active. So passive is just no amplification in it, and then there's active that has amplification in it, meaning that they're for patients who have hearing loss, but they still need hearing protection, who are out hunting. That option allows them to get some amplification, not the same as a hearing aid, so they're able to hear that deer or that squirrel or anything walking in the woods. And then when they fire the gun, it will dampen the gun out, and they'll be able, and then it will come back after the shotgun is fired.
That's interesting. You know, I've heard stories about people wearing their hearing aids to concerts and we're getting to cut them off or cut them down. And when you get that 100 dBs or whatever the levels is, like just wreaks havoc on their hearing aids. And I've just heard stories over the years about it was just like type situation. But I'm guessing technology's come a long way.
Oh, yeah. There's compression now, so and MPOs, which is your ceiling. And so that if the concert is loud, it's going to be loud, but it's also going to dampen that sound down too a little bit, and be able to allow the patient to hear, but not overly loud. But if the concert is that loud, it's just loud, and they likely need hearing protection in.
We got one comment/question here. We got a minute or less to get it answered.
Okay.
I'm sorry to put you under pressure there. Lane asked, because I guess this is the correct wording, but is hypervigilance normal for hearing loss tinnitus? Is he wording that right?
I think what he's saying, can he become hypersensitive to sound with hearing loss and tinnitus? Yes, that can be something that happens. Your dynamic range could have gotten smaller, so the sounds between soft and loud are very limited. We would definitely need to do a hearing test on that and then look at your dynamic range. But yes, you could be just very sensitive to sound because your dynamic range is smaller.
Yeah, I think his follow-up comment confirms that. He says, say a loud box fan at night, I hear everything.
Mm-hmm. So he may have a little bit of hearing loss, but not an excessive amount, but his dynamic range has shrunk, and so sounds are very sensitive to him.
All right, one last little comment from you. Should people avoid using Q-tips?
Oh, that's a good one. I actually am going to do a Facebook video on that. You're not supposed to use Q-tips because you don't really realize how far you're poking it down in there, but also you're not using them routinely, and what you end up doing is impacting wax in your ear instead of removing it.
I try to kind of spin it around just to kind of get the moisture out of mine more than anything.
To get moisture out, I highly, highly recommend just getting one little square of toilet paper, putting it on your finger, and putting it in your ear. Toilet paper is so super absorbent. It is going to pull that moisture out way better than a Q-tip ever will pull it out.
Perfect. We'll be right back to land the plane for hour one with Dr. Carrie Snyder with Home Hearing Healthcare. This is the Clay Edwards Show. We'll be right back on 103.9 FM, WYAB. Welcome back in to the Clay Edwards Show here with Dr. Carrie Snyder, Home Hearing Healthcare. Guys, we've got about a minute and a half left with the good doctor. There's so many more things we could talk about. Look, you need to be as serious about hearing loss prevention as you would be about hearing loss fixes. They have all different options available there at the office that can help you save your hearing before it ever gets in trouble with custom fitted hearing earbuds and just everything. Dr. Carrie, I appreciate you coming in. Next time you're here, I want to get into the live music aspect of things and in-ear monitors and all the protection for DJs and musical artists and the technology and the AI stuff that's out there. Just there's so much more we can get into that I know my audience would enjoy. I know I would enjoy selfishly. So I do enjoy these. Again, homehearinghealthcare.com. Home Hearing Healthcare located at 204 Key Drive in Madison, Mississippi. Their phone number is 601-351-5433. Dr. Carrie Snyder, homehearinghealthcare.com. Thank you, doctor.
Thank you.
Yep. All right, guys, we'll be back in 7 minutes, and it'll just be me up here in the studio. Get ready. We're going to talk about the Macomb chaos going on down there.